Karen Baldiga from the Hoisington Chamber of Commerce. And today I'm hosting an FAQ with Clara Barton Hospital and Clinics. They are here to answer the questions that we may have in the community about the coronavirus. The information that we're receiving from the CDC, our government, and our own Barton County Health Department is changing weekly, daily, and sometimes even hourly. The Hoisington Chamber of Commerce wants to help get the information out to our residents and our members as soon as possible. So we'll be hosting these either weekly, maybe even bi-weekly, or as often as needed. And we're so grateful that we have Clara Barton to help answer these questions. If you have questions that you would like answered, please email them to the Chamber, Hoisington, COFC@outlook.com, or call the Chamber at 620-653-4311. Thank you.
All right, I'm Dr. Scott Webb from Clara Barton Hospital and Clinics.
Thank you. The first question that I'm going to ask is a two-part question. Is the coronavirus airborne? And if so, should the residents in Barton County wear cloth face coverings such as a mask or a scarf when they are in public spaces? Or is this really only for those parts of the country that have been harder hit, like New York City?
Okay, yes, so the coronavirus or COVID-19 is a airborne illness. So it is important, I think, to wear cloth masks. That was a new guideline initially. The guideline was not they weren't quite so sure about masks, but it is now clearly been shown that cloth masks will protect other people. So really we're protecting other people when we wear a cloth mask. And we have just recently at Clara Barton made it institution-wide just this week to try to get everybody wearing cloth masks. So when you come in as a patient, it's a good idea to wear a cloth mask, and hopefully you'll be seeing more and more of us wearing cloth masks.
And do you have some samples that you were going to show us?
Yes, I do. So this is my cloth mask for the day. See, I'm color-coded. And so that's somebody was gracious enough to make that for me. This is more of a kind of a surgical mask. It's a little bit better fitting as far as it has the nose piece that kind of forms around that. So this is more of a surgical mask. If you come in and have symptoms in our hospital, we're going to give you one like this. If you have symptoms that we think are potentially contagious, so specifically fever, cough, those kind of things. And then you've heard a lot, this is actually the cloth the surgical masks are considered PPE, and so those are in kind of limited supply. And then this is the N95 mask that is more form-fitting. You can see it's a lot more rigid. These we can reuse for several, usually within 24 hours is what the current recommendation is. Although there's some things out there about trying to use them longer and make them last longer. But this is the N95 mask. This is mainly for people that are on the front line of healthcare. This is not usually done by the patient, whether they're infected or not. So those are the different types of masks you'll see. We also include, when we are fully protected, we wear the gown. We would wear a face mask as well to kind of cover our eyes, and then head and foot gear as well.
Great, thank you. I've heard the term coronavirus and COVID-19. Can you explain the difference between those, if there is one?
Okay, so yes, so the coronavirus is actually a group of viruses that includes COVID-19, which is more specific. So it's kind of like saying influenza is corona. The kind of influenza encompasses a whole bunch of different strains. COVID-19 is one of the more specific strains. So it's, yes, we kind of lump them together and kind of talked about the same, but that's kind of the main difference.
Thank you. Recently, the Barton County Health Department released protocols for first responders and healthcare providers. Can you explain what these protocols are and why they are necessary?
Yes, so I'm generally aware of those. What basically, if you call the ambulance, the dispatcher will ask you a set of screening questions, much like what we ask when you come into the hospital or the clinic. And that is, we're trying to determine if you have an infection and if it sounds suspicious for COVID. So if you're calling in for chest pain, still going to ask those questions, because sometimes chest pain can be your heart, sometimes it could be your lung, and so we are trying to kind of ascertain how aggressive to be with our own personal protection. So when the dispatcher will do that, if they have time, the ambulance crew may actually call your house before they arrive if they have time, and then depending on what the situation or the call is. And then they're going to also dress accordingly and protect themselves, because we only have so many healthcare workers, we only have so many ambulance personnel out there. So that is the purpose. And it's very similar to what we are doing at all the healthcare facilities. We're trying to kind of ascertain. So if you have a cold and need to be seen, we're going to probably have a nurse call you back and make sure that we screen very carefully kind of what those symptoms are, and see if we can kind of offer options for you to get the appropriate care. And if you do need to come in, we'll make the appropriate challenges, or make the appropriate concessions to kind of make sure it's safe for everybody, including you. So along those lines, we have made a lot of attempts in our organization in the last couple of weeks to do something that's called telemedicine, and some of you may already be familiar with it, but we are doing a lot of visits now by phone or by video phone chats. I've had one already today and have about 10 for this afternoon scheduled. So we're doing quite a few of these, and they're very, very helpful. It's very we've used a variety of different platforms to do that. We're working on having our EMR platform be available to do that through the portal, patient portal. But right now, CMS and which basically Medicare and the government has made, and a lot of insurance companies, I would say most insurance companies, have made a lot of concessions to allow us to do these kind of visits to minimize people-to-people contact, but still provide health care. And after doing them for a couple weeks, I can tell you that I think they're excellent ways to communicate. They're not perfect. I still like to listen to hearts and lungs, but they're better than nothing. They're certainly better than a phone call.
Okay. We have talked a lot about how not to get the coronavirus, but if we were diagnosed with it, how would it be treated, and how long is the normal recovery period?
Okay. Good question. So I think it's extremely variable how the coronavirus affects people. It can be, some people may just have a stuffy nose and a sore throat for a couple of days, and other people can end up on a ventilator and have respiratory issues. A lot of it seems like, depends on what your other health risks are. So that's why we've really focused on telling people to stay home, and if you have health conditions, chronic health conditions, or particularly the elderly. So our treatment is geared towards preventing it, because there is not a lot of treatment available for it. There are a few treatments. You heard President Trump recommend or talk about some of the treatments that are available. We do have some treatments if you get critically ill, but a lot of times we're just going to be treating those symptoms with maybe an antihistamine, a non-sedating antihistamine to help with the runny nose or the sore throat. Tylenol is preferred. Even if you have some liver problems, Tylenol is probably better than anti-inflammatories like ibuprofen or Aleve, because we feel like possibly the anti-inflammatories may aggravate the disease. That doesn't mean that you need to stop your anti-inflammatory if you don't have COVID symptoms, but if you do develop a fever, this is probably a time to use Tylenol at this point in time. So I don't know if that answers your question.
It does, completely. Thank you. I have seen many people post on social media the following question or the following post. Who got sick in November or December and it lasted 10 to 14 days with the worst cough that wouldn't go away? The post says, if you can answer yes, then you probably had the coronavirus. There were no tests and the flu test would come back negative anyways. They called it a severe upper respiratory infection. Is that possible that people had the coronavirus and we didn't know it?
That's a very good question. I don't know if anybody truly knows the extent to which the coronavirus has been in our community. As a medical professional, I would be very hesitant to say yes, that you definitely had corona, because there's absolutely no way. Even the experts don't know how prevalent corona was in this area. The new antibody test that just is getting approved this week will hopefully kind of start to identify how it was, maybe how much it was here in November and December by going back and looking at specimens from that time. But at this point in time, we really don't know. And the honest truth is, I could probably name off 10 viruses that do that exact same thing. And so I would be very, very reluctant to say that, or very cautious to say that, or assume that you had COVID, because that even people that have been diagnosed with a COVID test, we can't even say if they're totally immune from it afterward. We don't even have that knowledge yet. We're going to have it. I think within 3 to 6 months, we're going to know. Even within a month, what we know now compared to what we knew a month ago has dramatically changed. So we live in a great country where we're going to figure this out and get over it. But at this point in time, I would not assume that you had it.
Okay, thank you very much.
Thank you, my pleasure.